takes time. So in that gap, then you're not covered with either Western medicine or the natural products not covering you yet. Okay?
Okay. All right. Okay. Thank you. Thank you, Dr. Siva, for Ramesh. And then I have Mohammad Jalil. Mohammad Jalil. Okay, I got two more person, and then after that, Dr. Furi will be on. Okay. So Mohammad Jalil, can you ask your questions? I'm going to unmute you. Go ahead.
Hello.
Yes, sir. Where are you from?
I'm from Sri Lanka. My name is Mohammad Jalil.
Okay, sir.
My question is due to this Corona COVID, a person who has got positive now is okay. Now, any number of water he has to consume for a day. The hospital has informed that the water should be a limit like 1 liter for a day. Is there any particular on this?
Okay. You see, water, why they ask you to take more water? Because your body mechanism will start working, start moving, and then sometimes you feel heaty and all that. That is why they ask you to take. Yeah. So I'll ask doctor to answer the question for you now. Okay. Go ahead, doctor.
Okay, so let me just understand this correctly. So this particular person has been diagnosed with kidney failure.
Let me just ask me to it. Huh? Go ahead, Mohammad Jalil. Doctor, ask your question. Yeah.
Get that clearly. Is it that the patient has been diagnosed with kidney failure?
Not kidney failure. He got COVID-19.
Okay, COVID-19. All right. And the doctors have asked him to restrict fluid to 1 liter per day. Am I right?
Correct. Because he is he gets more thirsty, but the urine doesn't pass.
All right. So the urine doesn't pass and he gets more thirsty. So probably, you see, COVID-19 also affects other organs. Maybe there is some, not kidney failure, but maybe there's some impairment in the kidney. You know? So that's why they want to restrict the fluid. So therefore you have to follow the fluid restriction. So what I would suggest is that if you're going to take the product, so maybe you need to, I mean, you know, I'm not sure what products you're taking and how, I mean, if you're going to, let's say, take 2 or 3, maybe you got to take 1 at a time, 1 for today, because of the fluid restriction, they can't increase the fluid. Okay. Now, as the body gets adjusted, then you can add on the next one. So then you can take, for example, SCC and SC30, for example, all right? Initially, you start off with 1, and then you see the body will feel the heatiness and all for a couple of days, or maybe, you know, a week or so, and then after that, it will adjust. And then you can go on to 2 types of products per day. But you can't change that water content, because otherwise you may find a situation where the body is not able to eliminate the excess fluid, and then the lung will get congested with water.
Okay. Right? All right. So hope that answered you, Mohammad Jalil. Okay. Now, the one more questions or 2 more questions I'll get. Then after that, I'll call Dr. Ofori to carry on. Okay. Wait, let me see. Miss Helena. Okay, where are you from, Miss Helena? Go ahead.
I'm calling from London. I'm in London.
All right.
Yeah, I just wanted to find out if someone have myasthenia gravis. Which of the product can he use?
Okay. What is the name of the illness again?
Myasthenia gravis.
Okay, myasthenia gravis. So this I will, Dr. Shiva, you want to answer, or we get Dr. Ofori to answer first? No, later.
Just give my input. Probably you can take the SCC15 with the along with your SC30.
Okay.
All right.
Okay. Generally, SCC30 is actually fundamentally is actually a foundation for any sickness, any health. So that must be there. It's a foundation. It works on the cellular level. Whereas SCC15, like what doctor said, 80% of the immunity is actually in the colon. If your colon is congested, if you have got a lot of issues there, if it's not cleansed, then immunity cannot be, the enzymes cannot be released. So that is why they ask us to cleanse the colon also. So since we have both, if we can afford to have both, go ahead. Otherwise, the most powerful product will be SCC30. Okay. Now what I'm going to do now, guys, those of you who have questions, you just reserve your questions so that Dr. Ofori will come into the picture. I'm going to get Lovet now from Greece. to ask one question because this person has put their hands for quite some time. Ms. Lovett, can you ask your question now from Greece? Are you there, Ms. Lovett? Yes, go ahead.
Yeah, hello.
Hello, Lovett. Okay.
Superlife.
Live is super. I like it.
Yeah. So I have a friend of mine. He cannot see because I invited him before to join, but due to the condition of his eyes, he couldn't join the Zoom meeting. So he told me to help him to ask someone that have a clearly vision. What would that person take? And the person was taking SCC15. He just took only one packet before. So now the packet is finished and the crowd is still there. He's not asking what else will he do or what else will he take.
Okay. All right.
He's hearing, I called him on WhatsApp not to listen. If he can hear, I don't know, but I think he will hear you.
All right. Okay. You see, these questions all are pertaining to the products, and then I want Dr. Ofori to cover the products first, and then at the end you will have answers to all these questions, because as he's covering on the product, most of these questions will be answered. Okay, so at this moment, Dr. Siva will be here. Let Dr. Ofori come into the picture now, and then I will get Dr. Siva to rest for a while, and towards the end, you can ask both of them the questions so that you'll be more complementary and integrated. Okay, so otherwise it will be like you'll have one side of the answer. Okay, so so Lovett, just bear with us for a while, then the answers will come to you. All right, so now I would like to thank Dr. Siva for his wonderful time for sharing with us, and Dr. Siva has presented papers into international and local also, so he's covered quite well on why immunity is very important, how to manage immunity and all that, and how our products also can help that. Now, guys, you all know Dr. Ofori. Dr. Ofori has been with the company for almost the last 1.5 years, and he's a Ruby Direct, and he's a medical doctor, and then he has also taken the product for his own ailment and all that. So now let's hear from him, and he will also compliment on what Dr. Siva shared and how the products can help, especially on SNC and all. Okay, so can I have Dr. Ofori, please?
Thank you, Dr. Maha. Dr. Maha, please, are my slides visible?
Yeah, visible.
Okay, thank you. Dr. Silva, nice meeting you and sharing the same platform with you. As a senior colleague, I bow to you for this wonderful presentation. I myself have also learned a lot from your slides. God bless you all. Victory Namake, Victory Nicham. So ladies and gentlemen, my name is Dr. Nathaniel Ofori. I'm a medical doctor from Ghana, and it's been a one pleasing pleasure as well as a privilege connecting with you all globally through the power of technology called Zoom. It's our second health symposium. And just as Dr. Silva has talked extensively about immunity, I'm now going to correlate all that he said together with what our product can also do to help us all. Most of my research work was done by these doctors who lived in the 90s. We have Dr. Jules Hoffman, Dr. Bruce Bowler, and Dr. Ralph Stanley in 1973. And they were able to study significantly how our immunity plays a role in our survival. And so in 2011, they were given a Nobel Peace Prize for their research they have done. And all that they are saying is that our body, if it doesn't have immunity, we are going to have illnesses, because as a human being, you are exposed to toxins daily. So we have two groups of immunity that the body is going to undertake. The first is innate, and the innate means that it is outside. It is the first barrier to infection. So we have most of it covered by the skin and mucous membrane. When whatever pathogen or virus or bacteria traverses the first barrier, then the adaptive also comes in. So the adaptive immunity basically happens when the thing enters the bloodstream and it is in circulation. So the adaptive immunity now comes to pick it up. I want to just do a casual view of what Dr. Silva was doing so that you picture what it is that he was trying to say with pictorial evidences.
So if we talk about the innate immunity, whereby the skin plays a major role, the skin has a barrier called epithelial layer. If a virus or bacteria or any foreign body attaches it, we have natural killer cells and complement cells that goes to attack it and kill it. On the natural killer cells, it has its arsenal. We call it CD cells. So we have CD6, CD2, CD6, and CD65, and that is what it uses to kill these bacterial viruses. Now, if the bacteria start to duplicate and it outnumber the immune cells, then it enters the bloodstream. As soon as it enters the bloodstream, the blood also have B cells, B lymphocytes, T lymphocytes, and antibodies that also go into kill all these foreign pathogens. So let's look at the innate immunity where the skin plays a major role. We have the outermost layer of the skin called the epidermis, which is in stratifications. I'm not going to mention any scientific name to confuse you, but the outermost layer is the epidermis and the innermost layer is the dermis. So the dermoepidermal layer, the junction, that is where stem cells are produced gradually. So it produces as one, then divides and then starts to proliferate. And as we age, it loses its function. This is an electron microscope that was used to capture what is happening in the body. So we have neutrophils, which are body's arsenal or immunity that is resting because there's no infection happening. But as soon as any infection enters the bloodstream, they are activated. So you see an activated form of the same neutrophils that were resting. Again, this is an electron microscope, but this one, they did a color electron microscope. So we have a bacteria called Shigella. This is one of the main causes of diarrhea associated with food poisoning. As soon as it enters the body and it is in circulation, the immune cells now try to engulf it into itself and start to release certain chemical component called lysosomes, which kills the bacteria and then make sure it is neutralized. And that is what the body's defense does. Where do we get some of these immune cells from? Majority of it is coming from the bone marrow, which produces the B lymphocyte and the T lymphocyte. But the T lymphocyte don't get matured in the bone marrow. It gets matured in a thymus. The thymus is an organ that is just above the heart and posterior or behind the sternum. The sternum is the bone which is closer to our chest, where the ribs comes to engage and interlock. If you look at the thymus, it contains cells we call the thymocytes, and they contains numerous forms of immunity. So all these small cells you are seeing are immune cells within the thymus. But there's a problem. If you are young and you are born, the thymus is hugely enlarged. As you are aging, nearing puberty, it still gets enlarged, but when you hit age 30, it begins to atrophy or begin to shrink. So you see that the thymus starts to increase in size as you are nearing puberty. When you hit age 20, getting to 30, it starts to decline. What that means is that the function, the number gets reduced significantly. That is why aging population are associated with low immunity. And this is pictorial view of what we are telling you. Again, in the 17th century, a Swiss doctor by name Johann Peyer identified that within our intestine, we have something that contains immune cells. So it was named after this Swiss doctor called Johann Peyer. So this thing you are seeing in the intestine, we call it Peyer's patches. So we have it at the jejunum, which is part of the small intestine, and then also the ileum. What it contains when you take an electron microscope is that it contains microfold cells, and these cells, if you do the biochemical analysis of it, contains a lot of immune cells that make sure any infection that gets into the stomach are battled with. So now, let's look at these two individuals. They are well known in the world of football. We have Diego Armando Maradona and Pele. When they were young, they were at their prime playing football. But 50 years, 40 years later, we have Diego Armando Maradona gaining more weight, getting a very big pot belly, and then this is Pele. What happened between these two individuals? It all has to do with lifestyle choices, and that's what Dr. Silva emphasized. In their young age, they were very, very slim, but in their adult age, something happened drastically. So now what Dr. Silva was talking to you about our lifestyle, lack of activity, poor nutrition, fast food, alcohol, exposure to toxins, UV radiation, smoking. These are the things that everybody is going to suffer and is going to reduce our immunity drastically. So if you take a normal cell like this cell in a sterile environment, when it has not been having exposure to any toxins, its cell membrane is intact. The cell membrane is very, very, very intact. But as it gets exposed to toxins, it undergoes oxidative stress. And so the integrity of the cell membrane is even hampered, and it's because of free radicals as a result of the body's process of fighting all these illnesses. So it was for that reason that in 2015, the World Health Organization came together to change the Millennium Development Goals and now named it Sustainable Development Goals. And one of the Sustainable Development Goals is good health and wellness, because if they're able to tackle this thing, that is where the world is going to improve. Without health, you do not have a very stable economy. There are about 17 of them, and number 3 is basically going to talk about our good health and well-being, and that's what Dr. Fred Zuli, the man who produces most of our products in Zurich, did. His factory has a lot of history because they started in 1991, and this is another doctor he recruited early part of his organization. He's called Dr. Daniel Smith. He's the head of research in Mibel Biochemistry, and they do extensive research on the active ingredients of whatever product Mibel Biochemistry have been doing, and that is why the company has been winning Innovative Prize Award consistently since 2017 when Superlife partnered with our company. The office is in Zurich where they produced our products. Currently, we are having a manufacturing plant in Malaysia where our products can also be manufactured globally and distributed. So now we are going to show you a scientifically tested and proven product that is in the market that do help everybody. Before now, we had only 3 products in the market: Superlife Total Care 30, Superlife Colon Care 15, and Superlife Immune Care. But on the 22nd of June, we launched a second product. The technology we are using is called PhytoCell Tech, and it's a nanotechnology whereby we take the cells of plants and extract its active ingredients and make multiple uses of that. This technology was launched at Rio de Janeiro in 2012. 2 years down the line, it won its first international award, which is the Sustainable Award in Cosmetics, because this technology, the PhytoCell Tech, was now being used in the cosmetic industry before they started the nutraceutical portion of Mibel Biochemistry products. How are our products manufactured? What they do is that they are able to take active ingredients from all plants that they deem fit to boost the immunity of human beings. When the active ingredients are extracted, they put it in an agar, and the agar helps the active ingredient to now grow. Then they will put it in a photobioreceptor, and that proliferates it into multiple molecules, and they are made into powdery, which is marketed globally. Now, SCC15, our flagship product, contains an apple stem cell, which is a Swiss apple named Malus domestica. It helps regenerate new cells in the skin. Its activity is enormous, particularly for people with it helps with anti-aging property. Many people that take our products tend to have to regenerate new cells that make them look very, very young. The anti-aging property in the Swiss apple Malus domestica is really, really incredible. Grapes also have antioxidant property and anti-inflammatory property that mops up toxins that are in the cell, and individuals with lots of pain due to free radical deposition in the joints are healed because of our grape stem cell active ingredient. Now, bilberry does 4 main properties. The first is that it protects the liver. The second is that it also protects the kidney. The third, it also protects the blood vessel. The blood vessel has three main structures. We call it tunica intima, tunica adventitia, and tunica media. When you are aging, it begins to dry up, and so you get a condition called atherosclerosis, and that is associated with so many heart conditions. The bilberry component maintains the integrity of our blood vessels, so that blood flow from the heart to the liver, from the heart to the kidneys are maintained at optimal level that do not lead to liver problem or kidney problem. Glycoside gantalupe and glycoside gliadin contain the SOD, superoxide dismutase, which is a powerful antioxidant that does more of the mopping up of toxins in our system. And my favorite is the blackcurrant extract because it contains a pigment called anthocyanin, which is very rich in gamma-linolenic acid that protects our heart. And this product has proven to be very helpful. My research work done on it indicates that it is able to activate AMPK, which is a protein that is receptive to insulin. So people who have diabetes, when they take the product, because of the blackcurrant anthocyanin in it, it is able to activate the proteins on the pancreas, AMPK. And so it's able to mop up a lot of sugar from the blood, and blood levels start reducing. This does not necessarily mean that you have to stop taking your anti-diabetic medication. Just as Dr. Silva was saying, the body needs to be modulated. And so a doctor is the one supposed to help stop anti-diabetic products. By the cells doing all these things, it helps with macular degeneration, spinal cord injury, stroke, cancer, infertility, all because it is freeing the integrity of the cell membrane. The way the product is taken is a powdery supplement which is poured under the tongue. We have some sublingual glands there that make sure saliva comes at the floor of the tongue to take all the active ingredients into the sublingual arteries. That takes it to the external carotid artery and then the big common carotid, and then it gets into circulation. So bioavailability is very, very intact. The active ingredient that was made to make SCC30 do not function in an acidic medium. So if you pour it on the tongue and it enters the stomach, because of the acidity, it goes through a process we call first pass effect, where it is metabolized before it gets to the target organ. So bioavailability is drastically reduced. So for SCC30, it is recommended that you pour it under the tongue for bioavailability to be optimum. One sachet is equal to 1,500 milligrams, and that is equivalent to about taking 85 pieces of banana that contains a lot of vitamin B6, 22 kilograms of spinach that contain a lot of vitamin E, 44 large eggs that contain a lot of vitamin D, and about 19 pieces of oranges that also help boost the immune system. And that is what you are taking when you take a sachet a day. The way it is taken, you take it on an empty stomach, pour it under the tongue early in the morning. And if the person do not suffer from kidney problem, he can take between 200 and 300 ml of water after it is dissolved. But if the person has a kidney problem, it is advised not to be taking water alongside because fluid overload is not good for the kidney. On the 22nd of June, we launched our new products, and I think a lot of people will benefit if I delve into SNC first before the others. Now, SNC stands for Superlife Neuron Care. This product marginally help people with brain problem, eye problem, and then heart problem. How does that do that? It contains active ingredients called lutein and zeaxanthin. These are pigments that gives color to plants. So you see the color orange here is because of the lutein and zeaxanthin. They have the same chemical composition. The only difference is that where their double bonds are located makes it different. That's why their names are different. So we have lutein and zeaxanthin. One of the things it does is that it helps keep the integrity of the macular cells in the eye. So people that are aging get age-related macular degeneration that results in blurred vision. But people that take SNC, it is going to reduce the senescence or aging that is related to the degeneration of the macula, and so their eye integrity is going to be maintained. We have ginkgo biloba extract, and this product is very, very powerful. Studies indicate it increases nitric oxide by 12% in an aging patient, and so the nitric oxide extends the blood vessel for flow of blood to get circulated to all organs, and it also contains powerful antioxidants that mops up toxins, particularly in the brain. So people that suffer from Alzheimer's and dementia because of free radicals contributing factor are relieved on taking SNC. DHA is an acronym for docosahexaenoic acid, and it's an omega-3 fatty acid that helps reduce a lot of cholesterol in the vessels. And so people taking SNC are going to have a lot of cardio improvements. Now, Concord grape is my favorite among all these active ingredients we find in SNC because it contains a powerful molecule called resveratrol. You hear a lot of people saying that red wine is good for the eye. It's because of the resveratrol component in it. And Concord grape contains a lot of resveratrol, which also protects the heart, cardioprotective. Bilberry is very rich in vitamin C and also a very powerful antioxidant. So we've already narrated how antioxidants help because it mops toxins from our body. Now, spearmint keeps the integrity of the stomach very, very well, and it's one of the most powerful products that is also an addition, an addendum to the brain function, eye function, and the heart function that SNC is going to produce. Then we have saffron. You see, many women and men are going to go for SNC, not because of that they have an eye problem, a brain problem, or a heart problem, because the saffron is a natural aphrodisiac. So it is going to increase your libido and also increase your performance in bed. So many married couples are going to have these stressful issues of non-satisfaction in bed addressed by the saffron, which is also it also has anti-carcinogenic property. People who have cancer, they are going to get their problems resolved upon taking a new product that was just launched on the 22nd of June 2020. Now we have SCC15. Now, let me go back to SNC. SNC is taken orally, not sublingually. It is taken orally. So you can pour it on the tank and drink 200 to 300 ml of water, provided you don't have any kidney problem. If you also want, you can pour it in water, shake it very well, and drink it. That is how it is taken. Then we have SCC15, Superlife Colon Care. The active ingredients are enormous, and Dr. Silva mentioned, I showed you the Payer's patches and what it does. And Dr. Silva also mentioned that the body has what we call normal flora. We have organisms in our system that helps with digestion, but they are in ratio of 70-30%. So if you have the good bacterium now diminishing and the bad ones are increasing, it gives you a lot of GIT problem, gastrointestinal system problem. So we have lots of people with inflammatory bowel disease, hemorrhoids, all because of the disproportionate rate of the normal flora within the gut. So by taking these active ingredients, what they do is that they strengthen the microfold cells within the Payer's patches and also build more good normal flora within our system that detoxifies the colon and make it very, very healthy. In summary, this is basically what SCC does. It is very, very good optimum for gastrointestinal organ. Then we have SIC, Superlife Immune Care. These products have been fortified with berry, blackcurrant extract, iron, folic acid, vitamin B6, and magnesium and zinc. So it helps keep the integrity of the neutrophils, eosinophils, and all those components that Dr. Silva was talking about. You see, we have something called immunomodulatory things that is supposed to happen. Natural killer cells must have CD2, CD16, CD18. But if you are compromised because you have hypertension, diabetes, high cholesterol, expression is reduced. So this product helps express all the immune cells within our body and is working very, very magical. In summary, what we are describing to you that these products help rejuvenate aging cells and fortify it to get a lot of energy. The cells in our body that are in good state, it duplicates it more. The cells in our body that are sick are restored. Those that are dead are replaced, and the damaged ones are repaired. Basically, that is what stem cells, the phytocell tech we are using, does in our body. Our products have insurance liability by MSIG, which is a Japanese company, but we must be very careful because a lot of people now tend to use the word treat, cure, and so when it enters the mind of their client, they tend not to use their orthodox medicine, and they want to use this because they've been promised that others have a testimony, and so they want to use only this. If anything happens, MSIG states that do not give this product to a pregnant woman, a nursing mother, or anybody under medical supervision. Let the person inform the health practitioner that the orthodox medicine, the antihypertensive, anti-diabetic, is adding this food supplement so that the doctor is aware. This is a prescription you don't need this is a product you don't need a doctor's prescription. Anybody can take it because of the natural ingredient, which is organic, and because of its synergistic effect. And today I learned from Dr. Silva that preferably don't even take it alongside your normal orthodox medicine. If you take this product, wait for about 2 hours before you take your orthodox medicine, or the other way around. Now, many people, because of the money they are going to get, will still go ahead and do whatever they want. If Superlife gets sued, they have a disclaimer insurance liability claim that says that you do not use the word treat or cure, because the product actually does work, but never use the word treat or cure. And this is a disclaimer the company has made. Everybody who's a partner of Superlife, and you are registering, there's a checklist you have to check before you continue to confirm your registration, and that is to abide by the code of conduct of our product. Because of the quality of our product, we won the Asian Masterclass Award in Healthcare Supplement Excellence in 2017, the year Superlife was in existence. And then in 2018, the ESQR, European Society for Quality Research, gave Superlife the Quality Choice Prize Award Good category because of what the product is doing in the marketplace. We know the product have high quality and the results are very positive, provided you abide by the code of conduct. You have to be on this product for minimum 3 to 6 months, non-negotiable. The fact that someone used the product for 1 week, 2 weeks, 1 month and had a testimony does not necessarily mean that everybody would have the same end result. So I'm going to share with you testimonies, particularly of myself, that I have used the product for. When I started practicing as a medical doctor, I started with general surgery and I would stay in theater for so long a time. And I started developing some severe back pain. So when I got to use SCC15, which is the only product available in Ghana, it really, really helped me. I poured it under my tongue daily for 1 month and the back pain got resolved. And I met this patient who suffered from a condition called toxic erythematous necrolysis. And this is a condition that people's body are allergic to, even food or drug, particularly if it contains sulfur. Now, this person came to our hospital. The first person I called, because I was a doctor on duty, was a dermatologist, because that is her specialty. And when Dr. Damaris came, I suggested to her that upon the orthodox medicine, the steroids, the oral feeding, and all the nutritional supplements, can we also add a product I think will help the patient? She appended to my request and it became an addendum. Just within 15 days, we found significant recovery. And this is a patient who had suffered drastically upon taking a drug that his body reacted to. And with his permission, I took a picture with him when he was leaving, and we did the follow-up in a month, and this is our patient. So we know that the product really works. Now, I, as a doctor, when I realized that this product actually works, I endorsed it for myself and anybody I wanted to give this to. So how was I going to do this? The first thing I did was to go to people's offices where I was showing them the evidence that I have found, particularly for myself and for my patients. And I have this man called Mr. Osman Safiano, who's the manager of Ghana Water Company, and then Mr. Gossen Blebo. Apparently, these people were suffering. Within 3 months, the man came to me when I was having another symposium, and he came to share a testimony because he was looking for a child. It's not that he doesn't have a child, he has a child, but for 5 years, the second child never came. Upon using the product, the wife got pregnant. He used the product together with the wife. In 3 months, the wife got pregnant and delivered a live baby. So we now have a super live baby in my team. The testimony of the wife boosted the morale of Osman, who was also looking for a child. And so Osman too now has his child because his wife too was also looking for a second child. And I don't know what is happening in my team. We now have a third super live baby in my team by an immigration officer I recruited when I was crossing the border from Ghana to Togo. And he wanted to know if I could help him, and he shared with me that he was also looking for a child, and I introduced SCC30 to him. 9 months down the line, this man's wife has delivered. And I have a man in Ghana who suffered from an eye condition called pterygium. And this